What if I told you that the secret to protecting your vision and even improving your health might be hidden in your everyday choices? Imagine reducing your risk of eye diseases, cutting back on medications, and living a longer, fuller life with just a few powerful changes. Sounds incredible, right? Well, in today's episode of the IQ Podcast, I'm bringing on a guest who's dedicated his career to helping people unlock these very secrets. Trust me, you'll want to hear how simple shifts can lead to profound transformations. Stay tuned. You won't want to miss this episode. Welcome to another episode of the IQ Podcast. I'm your host, Dr. Rani Banik, and through this podcast, you'll gain insights into your vision health, your brain health, and your overall wellness to help raise your IQ. Today, I'm so excited to bring on today's guest, who is a pioneer in the field of plant-based lifestyle medicine. Dr. Jeffrey Pierce is a board-certified family physician by the American Board of Family Physicians continually since 2007. He's also board-certified in lifestyle medicine by the American Board of Lifestyle Medicine since 2021. Dr. Pierce is passionate about using a whole food, plant-based diet, and other lifestyle medicine modalities to help people live healthier, get off medications, and live longer, fuller lives. His goal is to meet his patients where they are and work with them at their pace to improve their health one day at a time. Dr. Pierce is licensed to see patients in California, Florida, and Texas. He is currently accepting new patients at the amazing nationwide telemedicine practice, Love Life Telehealth. I'm so excited to welcome to the IQ Podcast, Dr. Jeffrey Pierce. I am so pleased to welcome Dr. Jeffrey Pierce to the IQ Podcast. Thank you so much for joining us today.
Thank you so much, Dr. Banik. I'm so excited to be here. Thanks for having me on.
Absolutely. So Dr. Pierce and I met about actually it was a few months ago at a conference. And it's always a pleasure to meet practitioners across the country, across the world who are like-minded. And that's why I invited him to come speak with us, because he's got some really interesting stuff that he specializes in. And I wanted him to share his wealth of information. So first of all, Dr. Pierce, can you share with us what inspired your journey into lifestyle medicine and more specifically plant-based medicine, and how it's kind of all come together to transform your approach to patient care?
Sure. Yep. It was certainly a major influence on what I do today. I trained as a family medicine doctor, and I went to a program where we learned a very broad spectrum of management, from helping out in the operating room, delivering babies, working in the hospital, ER, and outpatient. And I struggled with working with outpatient. Even that's what most family doctors do, is seeing patients in the outpatient setting. Because in the inpatient setting, somebody could come in and say, oh, the baby was trying to come out the wrong way. We could do a C-section in a hurry and really save the day, and things seemed a lot better at the end of the day. And similar, someone coming in with pneumonia, we can get them on antibiotics, et cetera, get them out of the hospital in a day or two, and things were great. But in the outpatient setting, I felt like I was seeing so many of these folks with chronic conditions like type 2 diabetes and high blood pressure and heart disease. And I didn't feel like I was really making them any better. I was making sure that they were taking the right pills that I was prescribing. And if they were, and they still didn't have their, labs in order and their blood pressure where it should be, we prescribed new pills. But I didn't feel like I was really doing much to help them out. So the majority of my career for the first decade plus was doing stuff where you could see a major improvement in a short amount of time. I did a lot of global health, helping folks with HIV and malaria and malnutrition, and a lot of obstetrics, where things would just really result very quickly. But I wasn't really doing much outpatient medicine, hardly at all. But then I heard about lifestyle medicine, and that with a focus on some really key areas about what we do day in and day out, folks who are healthy and want to stay healthy, it works really well for that. But also folks who have been diagnosed with diabetes and high blood pressure and heart disease, if you really intensified these changes, what you're eating, how you're moving, how you're handling chronic stress, etc., all of a sudden you can start peeling off these medicines, folks feel better. And then that outpatient medicine got a lot more exciting because I really felt for the first time in a long time that I was really acting as a healer, as something more than just a pill pusher.
Mm-hmm. I can really relate to your story because similar to family medicine, in ophthalmology, you have the emergencies, which are, fortunately few and far between, but then you have this huge range of chronic conditions. And, it's easy to just write a prescription or to sign someone up for surgery. But what's the really more important thing, and this is why I focus on prevention so much, is counseling patients about what they're eating, how they're living their lives, what their stress levels are like, what are they exposed to in the home and potential toxins, things like that. And unfortunately, this doesn't get focused on, pun intended, it doesn't really get focused on in my field. And it seems like, it's an issue across many other fields as well, is getting to, get people healthier rather than to try to, kind of chase the tail, like trying to prevent it from happening so it doesn't get to that stage where it's so advanced and it can really cause issues. So I know that currently in your practice, you deal with a wide range of conditions ranging from diabetes to autoimmune conditions. Can you describe what are some of the kind of general strategies that you use for these conditions? And how is there like a one size fits all, or do you tailor it to the person? Like, what's been your approach with some of these strategies?
Sure. And I'm happy to talk about that. But I will say one thing you made me think something when you were talking about outpatient ophthalmology. I mean, as a family doc, I would complain that, we'd have a busy half day of 12, 15, maybe even 20 patients on a, horrible half day. But I know some of these ophthalmology practices are just, you might be seeing like 30 people in a half day or something like that. So 60 people in a day or maybe more.
Yes. Yes,
And
absolutely.
yeah,
Yeah.
and that's because we're not paid in large part, that the pay system is not such that, well, take as long as you need and we'll pay you for making our patients healthy and turn their life
Mhm.
around. No, it's just sort of like, well, the more folks you see in a day, the more things you can bill. And so it's just a messed up system overall here. And the ability to take more time and to talk about prevention like you do with your patients is much more meaningful and has bigger impacts on the patient. But right now, our payer system in general isn't set up for that system. So little by little, I think it's got to change. But anyway, I just wanted to.
Yeah, no, I agree completely. It's just most of us don't have enough time. And it takes time. It's not something you can cover in a 10 or 15-minute visit. It's much more involved in that. And sometimes we have to bring in other team members, ancillary staff, other services to help with this. But hopefully things change in the future, like you said, gradually.
Right on.
Yeah.
Okay. Well, getting back to your last question, Dr. Banik, so seeing folks with various chronic illnesses, what's the approach? Is it one size fits all, or something more tailored? So I would say, if we're just to take a lot of these chronic illnesses that are lifestyle related, so several of which what I mentioned, so type 2 diabetes, but also some things we haven't talked about. So some of the things like some of the lifestyle associated cancers, like large chunk of breast cancers and colon cancers and prostate cancers, and then a large number of autoimmune conditions like rheumatoid arthritis and lupus, high cholesterol, heart disease, et cetera. A lot of these illnesses have several things in common. So lots of inflammation in the body due to what we're eating, not, eating too many inflammatory foods, not eating enough anti-inflammatory foods, not getting the restorative sleep that helps in so many ways, not having a way to deal with chronic stress in a healthy way. And so inflammation and oxidation and so many of these pathways are common. And so it's, it's pretty amazing how a lot of the recommendations for somebody coming in who has type 2 diabetes and struggling to get down to their goal weight has so many things in common with someone with lupus, for example, or who wants to prevent a colon cancer relapse or something like that. So many of those, there's many similarities in the recommendation amongst highly variable groups, or what seems to be highly variable groups. But then on a patient-to-patient basis, of course, that has to be quite tailored, right? So some, as you well know, some folks come in and they have, they've seen the movie Forks Over Knives. They've seen their best friend has just dropped, 60 pounds and gotten off 3 medications, and they're ready. They are all ready to jump in with both feet.
Mhm.
And that's a very different conversation than somebody who, might be seeing you because their wife put them up to it, and this doctor's not going to tell me that I have to stop eating, my fast food and things like that. So, of course, we have to tailor our information and our approach based on who's sitting in front of us.
Yeah, absolutely. Meet them where they're at, right? Because otherwise they're not going to be receptive. That's what I found. Patients really have to sort of first kind of feel it out, how open they are to certain suggestions, and then gradually ease them into it if necessary, or just jump right on in for some patients. So I know that you have a passion for helping people get healthier, and kind of as a side effect of that, many patients are able to get off certain medications, maybe chronic medications for hypercholesterolemia or diabetes or hypertension. Can you share with us a patient story, like a success story of how you've managed to get them off of some of these treatments?
Sure. Yeah, I think that's particularly powerful because while, medications, let's just pick a blood pressure pill, like a common one, like hydrochlorothiazide, right? Probably one of the older and most prescribed blood pressure pills out there.
Mm.
You know, it, in one way, medicines like hydrochlorothiazide have helped just so many people out to keep their blood pressure lower and to help avoid strokes and heart attacks and things like that, and eye damage and whatnot by keeping their blood pressures in a normal range. But there are certain consequences associated with that. One, there's the idea that, oh, well, I can just go about doing what I was always doing because now I'm on this pill, which is going to fix everything, which it just
Mm-hmm.
doesn't, right? It might help lower our blood pressure, but it's not doing anything for our diabetes risk or for our cancer risk or for our inflammatory pathways going on in our body. And so there's that one aspect of it. Another is that, of course, medications have side effects, right? So what is it doing to our electrolytes, and what is it doing to our risk for other chronic illnesses, et cetera? And then, of course, there's costs. And so many things are involved in using chronic meds, and they can be very helpful in the right place for a right amount of time. But just the idea of here are 15 different medications that you need to be on for the rest of your life is something that we should really work so hard to avoid and to reverse when possible. So, for example, I have a good friend and patient who said, I've heard about how powerful this approach is, and I want to get healthier, and I'm ready to make big changes. And had autoimmune disease and diabetes and high blood pressure, et cetera, and was just did so many great changes with becoming more and more active, and taking the inflammatory foods out of the diet and adding just many more anti-inflammatory foods, fruits and vegetables, whole grains, legumes, things like this, was getting off all of her diabetes medicines, and then was sort of slower in mindset to get off of the high blood pressure medicines, but was starting to feel woozy first thing in the morning when getting out of bed. And we have to be very careful with
Mm.
somebody who is getting healthy in a quick way, which is amazing how fast someone can turn these things around. That if you don't get off your medicines, you might stand up out of bed in the morning and get hypotensive and pass out, and find yourself with a sore noggin, right? So we had to reduce your dose by half, and then come off the blood pressure medicine completely. So we have to be cognizant about these things, but at the same time, it's just so beneficial in so many ways to get off of these medications when you can.
Yeah, that's a great story. I have so many similar stories of patients who, have made that decision that they want to transform their health. They've done the important, dietary work, the lifestyle work, and they've been able to reduce their medications. But to anyone who's listening, if you're, if you want to jump on board, just make sure you're doing it in conjunction with your healthcare provider. Don't try to do it on your own, because as Dr. Pierce just said, if you're coming off medications, you can't just stop them. Sometimes you have to taper them down, and just be monitored very closely. So just be very, very cognizant of that. So another area that I wanted to talk to you about, Dr. Pierce, are mental health and brain related issues such as depression and even early dementia. Have you seen benefits from plant-based medicine and lifestyle medicine in these two areas? What's been your experience?
Sure. I think these are incredibly important areas to talk about and to think about, because there is just a very large amount of stress, anxiety, depression, of mental health disorders around the world. United States is no exception. And also dementia, with Alzheimer's disease being the most common cause, is also just on the rise. There's just more and more cases. And while, even if Alzheimer's disease happened only, to 1 in 1 million, it would be horrible, but it's, of course, much more common than that. And so while this is another reason why lifestyle approach, a functional approach to health is so important, because someone might come in because they're worried about, well, my doc says that I might need a stent or surgery for my blocked arteries. If things don't change, I really need to do everything that I can for my heart vessels. And you get on a program that addresses the day-to-day habits and make them as healthy as possible. And not only is that going to help them with their heart disease, but it's also going to help them with their underlying depression or anxiety, and also cut their risk for Alzheimer's and other dementias. And so specifically thinking about the dementia aspect, maybe first would be the work of Dean and Aisha Sherzai, who I'm sure you're aware of, have done some pretty amazing work in focusing on, well, what are some things that we can do to cut our risk for dementia? Dean is very enthusiastic and compassionate person about lifestyle medicine and dementia. And, he says that, at least 70, but maybe 80 or more percent of these cases can be prevented. And so they focus a lot on, well, what can we do with our diet? How can we move better? What about social connection and things like that really can help cut our risk for this. And quite excitingly, just very recently, Dr. Dean Ornish came out with his study results of a small group of patients with early dementia, mild dementia, right? And his approach is he sums up very, very simply as eat well, move more, stress less, and love more. And he'll say that it really is that simple, but he put the patients on a regimen of a plant-based diet with daily exercise and daily meditation and group work, and saw not just in the benefits for preventing dementia, which we all felt like that was pretty likely, but seeing these early cases actually show improvement in the various ways that they've been measured. And it's so important data to recognize and to talk about. My grandmother and probably great grandmother had dementia. Lots of us have a family member with dementia. And it's just something that we want to avoid at all costs, right? So
I want to just elaborate a little bit on 2 points that you made. Number one, there is a growing body of literature of scientific evidence to show that these dietary changes and lifestyle changes can have a tremendous impact. Not just a little bit of an impact, but significant impact. And so don't feel like, there's no hope, because there's always things that you can maybe consider doing to improve your brain health and your mental health. The second thing is that the approach is multi-pronged, right? It's not just one thing. Yes, nutrition, in my mind, nutrition is like the cornerstone of healthy living. But on top of that, you layer in the movement, the exercise, the mindset, and the connection. And I think that's what a lot of people, if they put all those pieces of the puzzle together, then they'll start to really see the benefit. So you try to, again, it's difficult. It's not easy by any means, but try to fill in all of those parts of the puzzle to really support your overall well-being. It's really, really important. Welcome back, everyone, to the IQ podcast. We're chatting with Dr. Jeffrey Pierce. So Dr. Pierce, I wanted to shift a little bit and talk about something that you have a passion for, which is gardening. And this is actually how I remember you the first time I heard about you, as you gave a talk at the plant-based healthcare nutrition conference on having your own garden, how to grow your own garden. So can you share with us a little bit about what you've been doing and what was the impetus for this, and give some tips on home gardening for listeners?
For sure. Yeah. And I'm glad we've got 3 or 4 hours to talk about this, because
we could go on and on, I know, but in a nutshell, you could summarize the most important points.
In a nutshell, a pistachio nutshell, because I hear that's
a good size. Pistachios are, plus they're good for eye health too. So yes.
I was never much of a fruit and vegetable grower. I did a little bit when I was a kid with my folks, but it was not a focus of mine in my adult life at all. And then met my lovely wife, who showed me that this is what she does all the time, and that's what I needed to do too. And so luckily I was smart enough to listen, and we converted our little house here in Northern California and just started putting fruit trees and veggie boxes, and it started off just because it was so tasty to eat homegrown produce. And then the more I did it, the longer I've done it, because I've done it now for over a decade, realized that it's actually really, really good for us on multiple levels. It's not just that we're producing a really tasty tomato that's great on our dinner plate, but that it gets us outside, it gets the vitamin D, it gets time in nature and the health benefits with that. It gets us really eating much more of the world's healthiest foods, because you need to keep up with your harvests. And there's the physical exercise, there's the stress management side of it. It just all adds up. There's the social aspects of sharing your produce and having folks over and saying, here's a meal that, most everything's coming from the garden and all this kind of stuff. It's just so healthy on so many ways. And it's gone from something that everyone did. Everyone, of course, had their own little plot back in the day, to now, kids not knowing the difference between a tomato plant and a basil plant if they see it in the garden. And while the ability to go to the store and buy food 365 days of the year, of course, is fantastic in many ways, we've gotten away from a lot of the we've gotten away from a practice that has been part of human development for just thousands and thousands and thousands of years. And so I have a big passion for gardening. I've become a volunteer master gardener through the University of California this year, and love to spread the knowledge of how to garden, to grow our own fruit and veg, and the health benefits associated with that.
Yeah. Well, I have to say, your presentation blew me away. You know, you showed pictures of your garden. It's so lush and just flourishing. And if you wouldn't mind, if we could share some of those pictures, if you could send us some of those links, then we could share them in the show notes. But honestly, I'm envious because you have the ability to grow your own garden and to eat from that garden, to reap its rewards. I live in New York City. I live in an apartment building, and we don't have greenery. It's very, very limited. There are community gardens, in the area, but given my work schedule and everything, I would love to have a home garden. So someday I aspire to have a home garden when I have an actual home where I could have it. But do you have any tips for people who are apartment dwellers, or maybe who don't have room, a plot of land in which to garden? What are some tips that you have for people like me?
Sure. Yeah, it's great questions. I mean, so many folks are living in apartments, little town homes, and there's sometimes a lack of time, sometimes a lack of light. So there are workarounds for sure. So there for folks who are living in New York, I would in the internet or in YouTube type in like New York growing veggies or something, and you'll see folks who are lucky enough maybe to have access to their roof and permission from the landlord to put some, pots on there, have a balcony, and putting, so many veggies can be grown in pots. Herbs are an easy one, for example, and always having fresh, having mint and basil and rosemary and things like this, access to that. And it's also been quite impressive to see what's come along with various little countertop or floor model indoor grow towers and things like that. Pretty
I've
exciting.
definitely seen those advertised. They look amazing. I've been a little hesitant to invest in one of those, but I'm seriously considering it.
Yeah.
Yeah.
And a lot of those, because it's right there in front of you, you don't have to like go out to the community garden, perhaps, which takes more time to get on the subway and things like that. It's right there. You do a few little things to it, and it fits in a busy schedule as well. There's a great book from a gentleman in the Northeast about how to grow your own. They're sort of like microgreens, but a little bit different. It's kind of halfway between microgreens and halfway and doing sprouts. But he lives in an area where it snows and is super cold during the winter. But he has a way of very simply in these little trays to grow seedlings that you harvest after about a week.
Oh,
And
wow.
I'll send the title to you so you can put it in the show notes. But there are definitely ways to get really nutritious foods in, even without a 5-acre plot, which we don't have, but I have a couple of friends that do, and woo, that just looks so fun.
What are your thoughts on I believe it's hydroponics? Is that correct? Like where you're just growing something in some water with adding some nutrients to it? Does that work?
It's pretty amazing. It works. I mean, I think some folks are like, well, you should be growing in the soil under the sun and stuff like that. And but like you said, not everybody has that opportunity to have a growing space like that. And while there's a lot of maybe initial cost and in plastic and all this kind of stuff initially, they are lower water use systems, even though they're based in water. They're lower water use systems than most systems where you're growing in the ground, because they recycle that water. And you can just have it set up and growing in your closet. And it's pretty amazing to be able to walk into your closet and harvest some basil and pick a few some lettuce and arugula and all these great foods that are have all your macular carotenoids in it, and
Mm-hmm.
put
Mm-hmm.
it on your
I can
salad.
tell you were at my talk, you were listening to my talk. I gave a talk
Yeah.
on ocular nutrition at the conference recently. So,
Oh, that's an
um,
excellent talk. Yeah.
oh, thank you. Thank you. So, we don't have that much time left, but I did want to ask you, I know that you're a big advocate of plant-based living, and its benefits for whole body health and longevity. What's the biggest misconception you've come across from patients regarding a plant-based lifestyle? Like, is there some myth that you want to dispel?
Sure. I mean, even back when I was first switching from my sort of typical Texan diet to a healthier, more plant-based diet, yeah, I thought, well, I don't really like salads, so
Mm-hmm.
how am I gonna do this? I've the salads that we'd get at the restaurant sure were boring, and I don't want to do that. And to tell you the truth, even though I'm 100% plant-based, like I kind of rarely eat salads. I eat greens on my food all the time. Like I'll have a great big bowl of beans and brown rice or quinoa, and chop up collards and kale and chard from the garden, and eat those greens probably twice a day on average. But
Mm-hmm.
but one thought is that if you go more plant-based, that you just basically you're going to eat salads, and that it's going to be boring. But there's just such a huge variety of plant-based foods out there that all you have to do is look at any of these wonderful websites that are plant forward or
Mm-hmm.
completely based, like Forks Over Knives or Dr. McDougall's site, or um, the Giroudi family site, all these different wonderful sites, and the meals are so just gorgeous, appealing to the eye, and full of flavor and hearty, especially when you're talking about the beans and chickpeas and the mushroom groups. So they're very very filling, and so that's I think a big one. Is that
Yeah. So yeah, people don't go hungry. I think that's the big misconception, right? It's just not going to be, and it's not enough protein. That's another myth that I always hear. But just the other day, I was having a conversation with someone, and in my book, I talk about having at least 5 cups of plants a day for eye health. And someone said, "Well, how can you possibly get in 5 cups of veggies and fruits?" And I said, "It's not just veggies and fruits. There's a whole world of legumes out there, and grains and spices and herbs." And so people, I think, immediately just think of like veggies and fruits, but there are other plants out there too that you can eat. So with all of their great nutritional profiles. So well, yeah. Well, thank you so much for spending this time with us, Dr. Pierce. I've learned so much. I always learn so much from my guests. It's great to hear everyone's perspective on nutrition and lifestyle and relate it back to what they do. So I'm kind of in my mind, I'm thinking of how I'm going to relate this back in my patient care to conditions like cataracts and macular degeneration and glaucoma. So I wanted to also ask you if anyone listening wanted to reach out to you or become a patient, how can they do that? How can they find you?
Well, thank you for asking that, Dr. Banik. I work for a great group called Love Life Telehealth. We're a group of just really passionate docs who meet people where they're at, to stay healthy or to get healthier based off of diet and exercise and sleep and stress and all that kind of stuff. And so you can just search Love Life Telehealth, and we will come up. And honestly, we cover all 50 states, and any of us would be a great fit for you. But we have little bios on there if you want to get to know us a little bit better. I'm licensed in Texas, California, and Florida to see folks. So if you live there or are in those states at the time of our visit, we can see each other. But really, the whole team is amazing, and I would send any of my family members to any of them. And so yeah, check us out if you're looking for a telehealth doc to work along with your primary doc. But then also, if you just ask your primary doc and say, hey, how can I heard this one doc talking about lifestyle medicine. Do you do lifestyle medicine, or is anyone in your
Mhm.
practice in lifestyle medicine, because I think the more demand there is from patients for lifestyle medicine, functional medicine, really a focus on using the best from Western science, but then also the best that nutrition and exercise science can show us. The more demand that we have from the patient population, the more the system's going to work, the more the insurance is going to pick their ears up about the importance of this, and it's just going to cascade.
Mm-hmm. Yeah, very, very important. One quick question. Does your practice accept insurances?
So currently we don't. It's very complicated with multiple providers in 50 states to get that to work. And to be honest, I have tried to do that in my own little micro practice, and it's just it's just been challenging. So what we do is that for anyone who wants a super bill, we say, okay, these were the diagnoses, for the visit for the insurance that you can then turn into your insurer. And the monies from FSAs and these others can go towards that as well. So there's various ways to try to work along with the system if you're seeing.
Yeah, I have a very similar model in my practice. Yeah. So, well, thank you again so much for spending this time with us, Dr. Pierce. It's been a pleasure chatting with you. And I will include all the show notes, everything we talked about below the podcast link. So thank you so much and have a wonderful day. And everyone, I look forward to seeing you all at the next IQ podcast. So stay tuned.